Thank you for letting me come talk to you today, Dr. Griffles. I know that you suggested that I come see you for a few sessions to talk about ways I can handle my sickle cell-related pain. But I am not sure how you can help me when I am in pain.
I definitely understand where you are coming from. A lot of people wonder how psychology can help with pain. Well, sometimes the sickle cell-related pain that you experience can be caused by or made worse with stress or negative thoughts and feelings. As the psychologist on the sickle cell team, I can teach you things to manage stress and negative thoughts or feelings. Your doctor works on your body, and psychology works on your thoughts and emotions.
Cool. What does that look like?
A lot of times, I talk with young people about how stress and negative feelings can contribute to sickle cell pain. Imagine you feel a little pain in your arm, then, you get into an argument with your dad. And, now that little pain that you were feeling is worse because you feel pretty upset about the argument with your dad. So, it is important for you to be aware of things and people that cause you to feel stressed. It can be helpful to try to avoid stress or situations that may be stressful.
I can understand that. I try to avoid all of the crazy girls at school that try to cause drama.
I also teach young people other ways to deal with pain. You can use some of these techniques while you are taking your pain medications.
I definitely want to learn those. I know that I can take medication when I am in pain, but I have heard from older people with sickle cell that sometimes people view us as drug seekers. They suggested that I use both medication and other things to deal with pain, but I never knew what they were talking about.
Great. One of the most common things that I teach people to help with pain is diaphragmatic breathing, or belly breathing as some like to call it. It won't get rid of your pain, but it can help. One thing though, be careful to breathe gently, and take nice slow and long breaths, especially if you are having pain in your chest, stomach, or back. We don't want you to be in more pain. Good question. You can do belly breathing either sitting up or laying down. Next, some people close their eyes, but you can keep them open while they do belly breathing. It does not matter which one you choose to do. The important thing is that you breathe in through your nose and out through your mouth. There are two other important things about belly breathing. Belly breathing is most effective when you breathe in from your diaphragm, or belly. It's like when you are blowing in an instrument or singing. Your belly, and not your chest, should rise when you do belly breathing.
I can do that. I play the saxophone at school.
Great job, Ruby. Secondly, you can count to 3 as you breathe in and then count to 3 as you breathe out. Another thing that psychology talks to young people about is when it might be helpful to get some help with all that is going on in your life.
What do you mean, Dr. Griffles?
Well, have you ever gotten so upset that you really just needed someone to talk to about what was going on?
Of course. I am in high school and my father gets on my last nerves all the time.
I see you know what I am talking about. Most of the time, we are able to deal with the stress or thing that is making us upset on our own or with some help from a friend, family, or your faith. And, sometimes, those helpful things just are not enough. When those things are not enough, I recommend that young people go see a psychologist or a therapist.
I've been to a therapist before. I went when my parents split up. I thought it was cool. She listened to me and worked with me on how I was feeling about everything.
I am glad to hear that. It can be helpful to see a therapist when life is a little harder than normal. This can help decrease some of the stress that you experience. And as we both know, stress is a big trigger for sickle cell pain. Ruby, I also know that you plan on going to college, so I want to talk about some things that you might not know about college and sickle cell disease.
Okay.
College is a great and exciting time in your life. Why do you think that is?
Because I can make my own schedule and don't have to do what my dad tells me to do. I am independent.
Right. And with that independence comes you taking more responsibility for your sickle cell.
I already do a lot of stuff without help from my dad. I use my cell phone to remind myself when to take my medications. And, I put my medications next to my cell phone so that I remember to take them in the morning. You know that I Can't leave the house without my phone. So, putting my medicine beside my phone is the best reminder possible.
Nice, Ruby. You should continue to do that in college. Also, there are phone apps that allow you to store your medical information so that you have it with you at all times. And, one thing that not many people know is that some of the medicine that you have is really powerful stuff, and it needs to be locked up in your dorm room or apartment so that no one else can get to it besides you.
Thank you for the tips, Dr. Griffles. I do have a question. What about exercising and sickle cell? I don't want to gain the freshman 15 when I get to college.
Exercising and eating right is a necessity for any person, including people with sickle cell. But, when you exercise you need to not overdo it and definitely hydrate before, during, and after you exercise.
Thank you Dr. Griffles for talking to me today. I really learned a lot.
Great to hear, Ruby. Now, let's get you back to school so that you can go to your favorite class. Math.
Now, Dr. Griffles. You know that teacher gives me a headache.